I'm Ray from Active Health Clinic, and I've been educating people on fatigue for about 10 years, first as a patient and now as a practitioner. And one thing that I've done across all of my patients with them have been discussing the types of fatigue. And I find this is a really good way to be able to verbalise your symptoms, but also to be able to understand in what way you need to recharge, because the way in which we're tired is the way that we need to recharge. So firstly, I explained that we have Cfs fatigue, and that is the one that we wake up with. That is the relentless one that is there day to day and doesn't necessarily fluctuate, it's steady. Then we have what we label as appropriate. Now what I mean by appropriate is, for lack of a better term, you've earned it. It's expected or it's normal. So at the end of the day, it's normal or appropriate to be a little bit fatigued, or if you've worked that day or if you've exercised that day, it might be appropriate for you to be fatigued, so you can see where it's come from. Then we have our physical fatigue, and this is the one that we feel within our body. This is where our body might feel super fatigued or lethargic or heavy, or where some of our physical based symptoms may come from. Next up, we have our mental, and I sort of break this down into two. We have our cognitive, which is our thinking and thoughts and problem solving, versus emotional, which is our mood. That can be happy, sad. So this is our mental based fatigue, and this is the one that we sort of feel head based. This can be where some of our brain fog comes from. Then we have our social, and our social is the one that sort of flatlines a lot of people. It's a really difficult one because it's all four of these into one. So you start off tired. It's appropriate to be tired after socializing. Generally, you're physically involved in the situation itself. You're cognitively involved in the conversation, and generally you're emotionally involved in that conversation too. So socializing can be socializing, but it can also be school or work or higher demand activities that require a few different types of energy. Number 6 is our setback tired. Now that is the one that we've done too much, we've busted. So that is that level of fatigue that we don't always experience, or sometimes we may, but it's sort of like a blanket of fatigue over our body on top of all of the others that we deal with. Now that one is activity related. That one is usually in response to something. Whereas number 7 is our immune or hormonal based fatigue. Now this one can come from colds, flus, allergies, hay fevers, stomach bugs, those sort of things. Or for the ladies, it can come from your cycle also. So it's really important to take into account that number 6 and number 7 will feel somewhat similar. Number 6 is activity related versus number 7 is in response to your body potentially working with something or fighting something off. So as I said, the way of which we're tired is the way that we need to recharge. So if we're able to recognize what type of tired we are then able to work alongside that and choose our recovery mechanism appropriate to in what way we need to recharge. So I encourage you today to have a look at in what ways you're experiencing fatigue, whether you can see patterns behind that, whether you can see restorative activities around that, and how you could potentially forward plan the ways of which you're tired and the ways that you need to recharge. So if you found this helpful, comment below or tag someone or share this with someone who you think may benefit from it, because I think everyone who deals with chronic fatigue needs to know that there are different types and that we should be looking at that as a recovery modality.